Okay, so let's try to discuss the questions here. The first question here is ND arc laser has a wavelength of. So the answer to this is correct answer is option 3, that is 1064 nanometers. Can you tell me in ophthalmology where do we use ND arc laser? Where is the ND arc laser? What is the use of ND arc laser in ophthalmology? Right, so it is used for posterior capsulotomy. It is specifically used in after cataract posterior capsulotomy. After cataract में हम use करते हैं ND YAG laser. Okay, we use ND YAG laser there. For LASIK, what laser do we use for LASIK? That is excimer laser. And what is the wavelength of the excimer laser? The excimer laser has a wavelength of 193. Okay, it is on a shorter side. Ultraviolet वाला होता है excimer laser. So remember, Nd:YAG is a cutting laser. Okay, for टोमी जहाँ पे भी होगा, जैसे posterior capsulotomy after cataract में करना है, तो वहाँ पे हम यूज करते हैं Nd:YAG laser. Very good. LASIK is 193, excimer laser. Going to the next one, nephrotic syndrome is characterized by all except. In the recent final punch, we had discussed that nephrotic versus nephritic. So what is not present in nephrotic is hypertension. You do have edema, there's hyperlipidemia, there is a lot of proteinuria that happens, but what is not there? Hypertension is not there. Hypertension is present in nephritic. Nephritic also has hematuria present, RBC cast present, right? While nephrotic has predominantly proteinuria, so there's edema, there is hyperlipidemia which is there in nephrotic. Okay, hypertension is present in nephritic, right? Going to next one, deficiency caused by eating white polished rice. Important, right? In vitamin deficiencies. By eating of what or by not eating of what do we get the vitamin deficiency? So particularly remember that if there is white polished rice, it is vitamin B1 deficiency. Thiamine deficiency is what we see. Okay, thiamine deficiency is what we see. Maize खाने से what vitamin deficiency do we see with maize? Maize causes what vitamin deficiency? Remember, maize is M. M को आप turn कर दो, this becomes 3. So that is niacin deficiency. That is vitamin B3 deficiency by eating maize. Okay, that is important to remember now. Right? And if it is a vegetarian vegan patient, then it is vitamin B12 deficiency. Okay, eating of raw egg white. Raw egg white is what vitamin deficiency? Biotin. Okay, vitamin B7 biotin deficiency because there is avidin present in raw egg white. Okay, raw egg white. So remember, white polished rice is going to be deficiency of vitamin B1. Okay, that is vitamin B1. Chat is seen, right? I can see the chat. I think you'll have that option in your screen of self chat and all chat. So just change that. You'll be able to see the chat. Okay. Next one, thrombolytics can be given in treatment of acute MI if the patient comes within how much time? So here they are asking you thrombolytics in acute MI, not in stroke. So in acute MI, we can give for 12 hours. While in stroke, what is the time window? It is 4.5 hours. Because if you give after this duration, then the risk of hemorrhage is more. Okay, the risk of bleeding is more. So it is 12 hours. In MI, after 12 hours, the myocardium, the tissue has become dead. So no need of using the thrombolysis now. There's not going to be much of benefit. So remember, in MI, it is 12 hours. In stroke, it is 4.5 hours. Okay, in stroke, it is 4.5 hours. Next one, red man syndrome is due to van. So remember, vancomycin. Red man syndrome is due to vancomycin. It's because of the histamine release. It can be prevented by giving slow IV infusion. Okay, by giving slow IV infusion. What is the mechanism of action of vancomycin? Is it a cell wall synthesis inhibitor or is it a protein synthesis inhibitor? Vancomycin Remember, van is a long van. So vancomycin is preventing the elongation when the cell wall synthesis is happening. So this is cell wall synthesis inhibitor. It's a gadi which the sun is asking for, right? Beta asking for cycle, Ford, bus, van. So vancomycin is a cell wall synthesis inhibitor. It is one of the drug which is used for MRSA, methicillin resistant staph aureus में. It is one of the drugs which is used in MRSA. Okay. Going to next one, what does pharmacodynamics include? So you have pharmacokinetics and pharmacodynamics. Pharmacokinetics, as the term says, what does kinetics mean? Kinetics mean that how the drug is moving in the body, right? So how are we taking the drug? What is happening to the drug after taking the drug? How's the absorption? How's the metabolism? How's the excretion? So what is the movement of the drug? How's the drug is being moved in the body? That is the pharmacokinetics. Pharmacodynamics means so elimination, excretion, absorption, all of this basically comes in kinetics. So the mechanism of action of drug, what is the drug doing to the body? That is what is pharmacodynamics. Okay, that is what is pharmacodynamics. So the mechanism of action comes under pharmacodynamics, right? The absorption, excretion, that comes in pharmacokinetics. Next one, what is the most common symptom of retrosternal goiter? So retrosternal goiter basically going into the mediastinum. Thyroid here, anterior mediastinum has TTT, thymoma, thyroid, terrible lymphoma, all of that. So you know that thyroid surrounding the trachea. So the most common symptom here is going to be dyspnea. And when we are doing surgery for retrosternal goiter, this is also a question asked. What approach do you take for retrosternal goiter? We go via neck. Okay, via the neck we approach the retrosternal goiter. Okay, retrosternal goiter. It is anterior mediastinal mass. Going to the next one, ligand for PPAR, right? This is basically PPAR involved in glucose and lipid metabolism. So in diabetes wala drugs, in short we have seen that PPAR gamma, glucose के लिए gamma, fats के लिए alpha. Alpha is FA fat and glucose is G gamma. So PPAR gamma पे कौन से ड्रग एक्ट करते हैं? The glitazones, right? The thiazolidinediones, rosiglitazone, pioglitazone, they act on PPAR gamma. PPAR is a transcription factor. Okay, so basically it helps in the utilization of glucose, right? Decreasing the insulin resistance. Remember, it is thiazolidinediones, which are PPAR. What PPAR is for glucose? This is PPAR gamma. Okay, this is PPAR gamma. Clear with everyone? Right? So remember, rosiglitazone is a drug which causes what side effect? MI, heart breaking. Rosiglitazone, MI. Okay, that is MI. All these thiazolidinediones, pioglitazone, rosiglitazone, they can cause fluid retention, and that is why they are not used in heart failure. If it is diabetes with heart failure, then what drug do we prefer in that case? It is SGLT2 inhibitor drugs. Okay, the flozins are preferred there. With heart failure, you will not give the thiazolidinediones. ठीक है, ये सब याद रखना. This is important. Next one, which of the following is a DNA virus? तो अगर आप देखोगे माइक्रोबायोलॉजी में सरप्लस टॉपिक्स में वायरस क्लासिफिकेशन डिस्कस हुआ है. कौन सा होता है DNA वायरस? So first of all, tell me in hepatitis virus, which is enveloped and which is non-enveloped. Hepatitis virus में कौन सा वाला enveloped है और कौन सा वाला non-enveloped है? Which is enveloped and which is non-enveloped? See, non-enveloped is the one with the absent envelope, right? So A and E. So remember, hepatitis virus A and hepatitis virus E, they do not have envelope. B and C, they do have envelope. Out of that, hepatitis B virus is a hepadinavirus. That means it's a DNA virus. Hepatitis C is a RNA virus. It's a flavivirus. Okay, it's a flavivirus. So remember, hepatitis B is a hepadinavirus. So that means it's a DNA virus. Hepadinavirus, DNA virus. Hepatitis B. Next one. Odds ratio equal to 1 means what kind of association is it? No association or positive association? Yes. Remember, in odds ratio, 1 means none. Okay, if there is 1, the odds ratio is 1, right? So that is basically none association. But if it was for relative risk, if the relative risk is 1, that means it is strongly associated. There's a positive association between two factors like smoking and lung cancer. So for odds ratio, no, not the relative risk. Okay, that is the coefficient. Okay, the coefficient of relation wala, that is what is your 1 is important there, right? The one that you get the coefficient in the scatter diagram, there you look for positive and negative. There 0 means no association. Here 1 odds for odds ratio, 1 means none. Okay, 1 means no association. Okay, 1 means no association. That basically tells you कि exposed non exposed जैसा in broad terms if I tell you कि उसमें equal association है, that means there is no increased risk. Okay, 1 means none.